So welcome. My name is Dr. Melinda Keller. I'm director of the Brooklyn Spine Center. We specialize in non-surgical spinal decompression. Over the past 8 years, we have seen wonderful results. Our program treats herniated discs, bulging, deteriorative discs, sciatica, stenosis. It is holistic, where we include spinal manipulative therapy, cold laser, therapeutic exercise, muscle reconditioning, and the results we are seeing are very rewarding and very terrific.
I had already made an appointment with a surgeon to do surgery to correct the pain in my back, which was affecting my legs. Dr. Keller said she would look at the x-rays and see if I was a candidate for the DRX 9000. I came back a day or two later. She said yes, she would take me on, though it was a very difficult case. And when she told me she would take me on, I burst into tears.
It really got to a point where I was more or less incapacitated. I couldn't stand, I couldn't sit. I've gone to doctors, I've gone to surgeons, I've gone for epidurals, tried everything. Everybody I went to kept telling me, surgery, surgery, surgery. That's all I heard.
This whole side of me over here was locked up, and I was frozen in basically like a monster position, you know, like you're walking, well, I started to think, well, what are the recourse that I have? Probably surgery. I didn't think like the aspect of surgery because, as I recall, I was told once you have the surgery, it's done. They fuse the discs and you're basically a monster for real now.
This is a model of what a herniated disc looks like. What the decompression table is looking to accomplish is not only getting you symptomatic relief, but repairing the disc as well. The decompression table actually separates the vertebra above and below the disc, takes the disc into a state of zero gravity. Once the disc is in a state of zero gravity, it then creates a negative pressure suction by creating a pump, and that aims to pull the disc back into position. It also rehydrates the disc, brings fluid back into the disc. The fluid carries the nutrition with it, and very often on post-MRI we see either partial healing of a disc or sometimes complete resolution of a herniated disc.
I was very happy when finally the DRX became available to me in this office. I did a treatment of about 36 visits over a short period of time, and after I completed the initial cycle, I've been able to really do anything that I want to do. I'm an avid cyclist, downhill skier.
I told Dr. Keller that I had pain in one of my legs, like when I walk, you know, like a nerve pain. And she read, you know, the x-ray. She's definitely have to go on to the DRX. And she told me, you know, the procedure and everything. I went on the DRX, and it's not a painful thing. It's a very relaxing thing. It's a wonderful thing. I like it, you know. And it helped me immensely right away.
Both Dr. Keller and Dr. Falcone, who were really on top of my treatment, they turned to me and they said, "We will get you better. Don't give up." And I stuck it out, and after about 18, 20 treatments, I really started feeling better. So they really saved my life, saved my way of life, and all of them, the entire staff here is really fantastic.
They made me feel very much at home here, very, very relaxed, because I came in, I understood that I didn't want the surgery, but I was nervous about the aspect of actually stretching the spine. Right, because you're dealing with sensitive nerves and tendons and so forth. They made me feel very relaxed. She explained in terms that I can understand exactly what the procedure would entail. And as far as professionalism, she's tops as far as my book. As far as I'm concerned, these are my angels here. They saved my life.
I come now every 6 months, and I owe it all to Dr. Keller. I mean, she's wonderful, and when I know about the staff here, it's like a family. They're the wonderful people. They're very caring, wonderful people. They really are.
She was wonderful, always there beside me. I didn't feel I was doing this alone. I always felt I had Dr. Keller and the staff with me. And after a while, with many times on the DRX 9000, I began to get better. Dr. Keller has given me my life back.
So if you are suffering from a severe back condition, neck condition, a chronic condition, if you have tried other things, perhaps been recommended surgery or injections, give us a call at the Brooklyn Spine Center. We'll speak to you on the phone and see if perhaps you're a candidate for non-surgical spinal decompression. Again, give us a call at the Brooklyn Spine Center and we'll see if we can help you.